have many people calling us about spinal injury or herniated disc or degenerative disc conditions in the spine. For many people in their 60s, 70s, 80s, if they suffer from degenerative disc conditions, sometimes the steroid would not work anymore. So even though they get steroid injection, it either didn't work at all or it would only last for 1 or 2 months. Then they had to suffer for 2 to 5 months before they get another injection. So when steroid injection stops working for degenerative disc conditions in the spine, the other option from Western medicine will be surgery. Of course, for some conditions, surgeries are not even an option. Or if you're advanced age in their 80s and 90s and with other heart condition or kidney conditions, you're not even the candidate for surgery. And I've seen plenty of people after spinal surgeries for stenosis or degenerative disc condition, they will still have severe pain, even though it's a different kind of pain from the pain they had before the surgery, but their pain sometimes are even worse than before they had the surgery. So going through the surgery, then you would have 5 to 6 months recovery time, and then you would still suffer from severe pain, affecting the quality of your life. Is that really a good solution? Some people, they're more proactive, and then they start doing sauna, massage, chiropractic, acupuncture, and many things. Then it can help alleviate the pain. But still, the degeneration is there. And if they stop doing any of these therapies, their pain would come back. So what is the root cause of the degenerative disc condition? Well, if your disc is already worn out between the vertebrae, you don't have a lot of cushion, you don't have a lot of lubrication. So then every time you move your body, when the spine has to twist or moves, then it creates inflammation. So that's why the pain can become very severe and debilitating. Stem cell therapy is actually an excellent alternative to surgery, steroid injection to help with degenerative spine conditions. The stem cells can regenerate some cartilage in the joint and also reduce the scar tissue caused by years of inflammation. Plus, it can rearrange the joint in the intravertebral joint area so that it doesn't have that much inflammation. And the stem cells are excellent in reducing inflammation. So for most people, even at age 90s, after stem cell injection in the spine, they would see some relief from the pain, the severe pain they experience daily from stenosis, degenerative disc condition, osteoarthritis of the intravertebral joint. So all these things can be helped with one single stem cell spinal injection. So as many of you know, stem cell injection is not an approved procedure in the United States. However, nowadays, in the past few years, some people can get access to the umbilical cord stem cells that are not expanded in the labs. Although it's lower quality, it is still umbilical cord stem cells. So some clinics in the United States do offer umbilical cord stem cell injection into knees, shoulders, and some other joints. But for spinal injection, it's a more complicated procedure that requires sedation and also the X-ray amplifying imaging to guide the spinal injection. So it needs a very sterile operation room to prevent any infection. So in this kind of situation, it is very difficult to find any clinic in the United States to perform this type of procedure. Most times, they use your own body stem cells to do the injection. And if you're over age 50 and your stem cells are also over age 50, then you may not get as good result as using umbilical cord stem cells. Umbilical cord stem cells, when tested strictly in the lab after expansion, without any contamination from other types of stem cells, and also not displaying any immunoreceptors on the stem cells themselves is an excellent solution for treating spinal conditions. And our clinic is conveniently located 10 minutes outside of the international airport of Medellin, Colombia. We're nested in the mountains with natural environment, clean air, natural food without preservatives to help you recover and reduce the chronic inflammation in your body with the help of umbilical cord stem cells expanded in the lab in Colombia. So in November, we have this patient who's 92 years old with severe spinal stenosis. His doctors in Wisconsin said the only option for him is steroid injection, and the surgery is not an option because of his age and his other conditions. We did the spinal injection into his lower spine, the lumbar area. We did altogether 4 injections on both sides, intradisc, intrafacet, and intralamina. After the injection, he experienced reduction in the pain in the back area and also reduction in the pain radiating down his leg. Of course, stem cell injection is not a magic solution for degenerative disc conditions. After stem cell spinal injection, you also need to combine with different therapies, including red light therapy, intravenous injection of NAD, acupuncture, radiofrequency therapy, and many stretching therapies for your particular spine condition. So you need to combine all these therapies together to make the stem cell therapy work better, with better efficacy and lasting longer. We only use umbilical cord stem cells expanded in the labs and strictly tested. And the stem cells we use are from donors who were not vaccinated with COVID-19. So you do not need to worry about any spike protein or DNA contamination.